embargo of Cuba and its return to and retention on the state's sponsors of terrorism list. With the events of yesterday, this may be a particularly opportune time to raise these issues again. My name is Peter Orris. I'm a practicing physician in Chicago, specializing in internal and occupational environmental medicine at the University of Illinois. I've had the privilege of serving on the attending staff at Stroger Hospital since 1979, and its president from 2001 to 2005. I'm speaking here today as an individual who's taught international health systems for over 15 years. Happy to report to you that with the support of the board, the Cook County Hospital Division of Occupational Medicine had a long and productive relationship with the Institute of Occupational Medicine in Cuba, beginning in the early 1980s, along with some of the major academic institutions in the U.S. We've had multiple conferences, exchanging medical information and stimulating research. As you're aware, Cuba has a publicly owned healthcare system providing every inhabitant with comprehensive healthcare from cradle to grave with no charge at the point of service. This is accomplished through a network of primary care, community-based family practice physicians' offices, backed up by an area of polyclinics, regional hospital, provincial medical centers, and national research specialty centers. They have physicians serving in 67 countries around the world and providing medical training to young people from low-income communities in this country, the U.S., provided they agree to return here and care for the poor and those excluded due to race or other discrimination. Chicago has, as a result, a number of practicing physicians who were trained under this program in Cuba. This ongoing humanitarian gesture underlines the Cuban avoidance of actions that punish the population of countries when seeking government policy changes. In the last few years, there have been a series of exchanges with the Cuban system funded by the Kellogg Foundation at the University of Illinois, where Cuban physicians have spent time here working with the University of Illinois and the Miles Square network of clinics to discuss increased community involvement in those clinics. I returned 2 weeks ago from a meeting of the Cuban Society of Public Health as part of the American Public Health Association delegation. We heard the immediacy of some of the simplest needs of this extraordinary healthcare system. Lab diagnostic equipment and polyclinics that's outdated and cannot be upgraded due to the embargo, requiring older, more time-consuming and less accurate methods. Shortages of gloves, cotton swabs, electrical outages, inadequate lighting due to bulb replacement problems, and the last 6 months of shortages of casting materials.
Time has expired.
Thank you, Doctor. Next speaker, please.
Steve Eckhart. Following.
Thank you very much.